My name is Mark Brooke. I'm the Chief Executive Officer of Lung Foundation Australia. Lung Foundation is the health peak advisory body to the Department of Health and Aged Care. And as part of that advisory body's role, our job is to ensure that the lived experience of patients are amplified as part of the National Lung Cancer Screening Program. The Lung Cancer Screening Program will commence on 1 July this year after nearly 5 years of preparation. It is imperative that our healthcare professional community take the time to study and understand what the lung cancer screening program is about, to learn and invest your time and your expertise in bringing about the much needed reform so that patients are diagnosed with early stage disease rather than late stage disease. 2025 is the introduction of the National Lung Cancer Screening Program, Australia's newest screening program and the first screening program to be introduced to our country in 20 years. This has been a project that has been 5 years in the making, commencing with a very rigorous program of work by Cancer Australia to test the feasibility, building on the international evidence from Europe and the US, and now our very own tailored program for Australia. The National Lung Cancer Screening Program is a generational opportunity to transform lung cancer in this country. The program will shift diagnosis from stage 3 and 4 to stage 1 and 2, which, as many healthcare professionals know, is transformative in the care for people with lung cancer. The Lung Foundation is incredibly optimistic that this is the right time to introduce this screening program to Australia because it will enable early detection and diagnosis of Australia's leading cancer killer. The lung cancer screening program is an enormous undertaking, particularly because it's based in general practice. So we've had to see our general practice colleagues integrate screening as part of their usual care. There will, of course, be challenges for tertiary healthcare, particularly with new nodules being found and incidental findings. But having just spent the last day with the Australian government and each state and territory government, I have to say to you, I'm incredibly confident that the organisation of the program and the preparation of the program is well advanced. The lung cancer screening program, when it kicks off on 1st of July, will not be perfect. But the patient community has clearly told us that they do not want perfect to be the enemy of good. So the program will enable healthcare practitioners to operate at the top of their scope of practice. And this is something that the Lung Foundation and our community has been advocating for many years. The National Lung Cancer Screening Program has been specifically designed with the needs for priority populations. Aboriginal and Torres Strait Islander people are substantially overrepresented in lung cancer, being diagnosed much later with much greater numbers of deaths. Equally, we know that there are challenges for Australia's rural and remote clinicians and patients. I'm really thrilled that the Commonwealth has recognised this and has taken steps, particularly for rural and remote communities, to introduce mobile CT trucks. Our partners, Heart of Australia, are delivering a world-leading, world-class mobile technology which will bring low-dose CTs to many communities that it is simply impossible to have those CT scanners situated locally. NACCHO, the National Aboriginal Controlled Health organisation, has worked incredibly hard with its affiliates all across the country to ensure that Aboriginal and Torres Strait Islander healthcare organisations are prepared. This program is specifically designed to ensure that First Nations people have a culturally safe and sensitive experience, one that attracts them and supports them in a holistic way. So I'm incredibly confident that the work that the Lung Foundation, NACCHO and others have been doing will see that from program guidelines to implementation to the registry and other facets of the program, that it is both culturally sensitive and tailored to the needs of those that are most marginalised in our community. For the last 5 years, the Lung Foundation has been sponsoring with governments in New South Wales, South Australia and Queensland a model of care for specialist lung cancer nurses. We did so because we know that specialist lung cancer nurses operating at the top of their scope of practice are will be actively engaging and participating in this program. But more importantly, from the evidence and the independent evaluation of each of those pilot projects, what we are seeing is that timeliness to care and the optimal care pathway is being exponentially improved for patients in healthcare systems. We're also seeing that valuable clinical time for respiratory, oncology, radiology and other healthcare practitioners are being used in other areas whilst nurses operate at the top of their scope of practice. For example, in many of our hospitals now, specialist lung cancer nurses are actively leading nodule management clinics, saving other healthcare professionals valuable time. But the most important thing about the Specialist Lung Cancer Nurses program is that patients are getting improved quality of care. So the evidence around PROMs and PREMs and the very clear indications coming back from the patient community is that governments and healthcare executives in hospitals must prioritise specialist lung cancer nursing if this program is to be a success. It is clear that the introduction of any program of this size will bring complexity and layers of opportunity unlike any other lung disease or lung cancer innovation in the last 20 years. The Lung Foundation and my hope is that we begin to see a stage shift, a transformation, so that more patients are identified and diagnosed at stage 1 rather than stage 4. Ultimately, the success of this program rests in saving lives. We know today that more people will die of lung cancer than breast, bowel and prostate combined. It's imperative that our entire clinical community take a can-do attitude to ensure that the lung cancer screening program is implemented as quickly as possible. This program will be ongoing. It will require the commitment and dedication, the skill and expertise of every craft group in lung health and lung cancer. And our hope is that you will listen to the community, listen to the patients, and make this thing a tremendous success. Because quite frankly, patients deserve nothing better than gold standard care.